A study in the New England Journal of Medicine reveals a disturbing after effect of time spent in intensive care units. John?
Patients are going into the hospital for treatment of a physical illness and coming out with dementia, even when they had no evidence of it before. 18 months ago, Lisa Uribe had gallbladder surgery. After the operation, she developed a severe infection and spent 3 weeks sedated in the intensive care unit. After waking up, she knew something was wrong.
I felt very confused, totally weak throughout my entire body. I thought this was something that would be normal for someone being in an ICU.
But after leaving the ICU, she never got better. Now 46, Uribe has short-term memory loss and trouble thinking. She's unable to work and sometimes gets lost when driving.
Being somewhere and not knowing why you're there or what your purpose was for being in this location, and it's a scary thing.
Very good.
Dr. Wes Ely of Vanderbilt University co-authored the study examining brain function in more than 800 patients who had spent time in the ICU.
What we found was a dramatic amount, 75% of patients leaving with cognitive impairment, and in fact, 1 in 3 leaving with cognitive impairment in the realm of Alzheimer's disease.
Those problems persisted for at least a year. There are several possible causes. Severe illness, which on its own can damage the brain. So can drugs used to sedate patients, as well as the disorienting environment of the ICU.
When they survive and they go through all of that ICU experience, then now they have to survive with essentially a new disease of the brain.
John, 3 out of 4 patients leaving ICUs with some kind of cognitive impairment. Is it mostly older patients?
It isn't, and that's the shocker. It's also people in their 30s and 40s, people in the prime of their lives.
What was most fascinating to me about this study is the reality that you leave and then you have the symptoms. What are hospitals doing to fix this?
They're getting very aggressive at decreasing sedation, which can increase delirium if you have all the sedation. They're getting people up and around. So if you're lying in bed, that can increase the change in mental status. They're having people walk up and down the ICU, even dragging their ventilators behind them with a physical therapist there to help them. And then they're also trying to make more of a day-night cycle. What's day, what's night, and cutting down on the noise.
And that's something families should do as well if they have a relative there.
Absolutely, and families can help. Just bring eyeglasses, bring hearing aids, and talk to them. What time is it? What's going on in the world?
Also this week, an important new